The golden years is a phrase that suggests the final decades of our lives can and ought to be our best years. Unfortunately, far too many people over the age of 65 are either well on their way to becoming frail or are already infirm.
The CARES program is an initiative that we've launched in Fraser Health, where we've partnered with GPs in their practices to identify patients in the practice that are at risk for developing frailty.
So the Frailty Index is a way to understand how fit or frail someone is.
If you're able to measure it and give yourself a score, you can follow that score over time to see whether the patient is getting worse or there has been some intervention that's helped them so that they do not decline into frailty.
So what we try to do is to provide a number that allows people to understand just how fit or frail an individual is.
If you'd like to just have a seat here. What we're going to do is an exercise that's going to measure the strength of your legs.
I have a patient, Billy, and at the beginning of our CARES prototype project, she enrolled in my practice. So I talked to her about the CARES project and the ability to assess her frailty status.
They did an assessment at the beginning where they looked at your cognitive and your motor skills. They were looking at, could you get up from the chair, could you walk down the hall, and then they give you some other tests to look at your mental agility.
Once the assessment is done by the GP and their frailty assessment is completed, these patients are encouraged to enroll in the BC Self-Management Program.
With so many people having chronic health conditions, you only access a health professional for a short period of time. So that means 99% of the time you're managing yourself. So that's when we thought of the idea of having a peer supporter.
The goal of a peer coach and this process is to get the participant to learn how to self-manage their own conditions.
And that means that once a week for 30 minutes, the coach would telephone the participant.
And then they're tracked to ensure that they adhere to their wellness plan.
I ask my participants to tell me what they've been up to.
There's a lot of resources available in the community that patients don't necessarily take up, but if they're asked by their family physician and a coach is calling them on a regular basis to enact that wellness plan, it helps with their motivation.
Usually a participant knows after a short period of time that some behaviors are not the best behaviors, but they'll tell me anyway because they want help. Well, then we'll talk about maybe some solutions to fixing that.
The communities have really developed a lot. There are resources, and I guess that's part of the resources empowering seniors.
I do have chronic conditions myself, and I can bring to the table my experiences. It's amazing because it helps both of us.
It's really a good example of how patients and providers work together to provide meaningful improvements for seniors.
The jolt for me was being ill, recognizing that, and I had to get back and do some things.
Soon, hopefully, we will have CARES spread throughout the region so that all GPs that want to do this will have this tool accessible to them.
It works, not just for the people you met in this video, but you as well. Next time you visit your doctor, I encourage you to ask about the CARES program.
It is possible to age well and avoid frailty.